Hi, I'm Felicity, a registered nurse, cosmetic injector, and founder of the Fit Injector Clinic. Welcome to my channel and video podcast streaming on YouTube, Spotify, and Apple. Today is episode 20, and I have Aska joining me today. Welcome.
Welcome. Thank you so
I'm so
much.
excited to have you here today.
I'm so excited to be here as well.
Let's get into it. So, Aska, you've been a registered nurse and cosmetic nurse for over 16 years.
That's right.
You run your own cosmetic clinic, Face by Aska, and founder of your training academy, the Academy of Cosmetic Medicine and Science here in Sydney. You also wear a whole lot of other hats, which we're going to get into as we go through the episode today. Now, you probably don't remember, but I sure do remember meeting you in a training session when I was a baby cosmetic nurse.
I do remember you.
You do?
I also remember Zach being the model.
A very long time ago. You were the clinical trainer for that day, and I was upskilling in injectables, and I was just absolutely in awe listening to you about the experience and how far you'd already come, and you were running your clinic, and just thinking how amazing that was, and just like what a goal to strive for in the future.
Oh, that's so sweet. Thank you.
And then it's, and here we are all these years later, ready to sit down and talk about what you've done. And you're still working 100 miles an hour.
Oh, I am. That's for sure. Yeah, that will never change.
That will never change.
Yes.
So today we're going to chat about your journey of becoming a cosmetic nurse as we're talking 15 to 20 years ago. We're going to discuss the challenges you had back then and how the industry has shaped and changed over the years and how it's growing exponentially now. We're going to discuss how new nurses can have guidance when stepping into the cosmetic field, plus your journey of being a businesswoman, clinical trainer, educator, and how you had a reality check when having a child with severe autism, and how this is helping you to relate to lots of other mothers out there facing challenges with children with similar diagnosis as well.
That's right.
Yes. So I really appreciate you coming and being raw with us today and talking about all of these things.
Oh, well, I'm very excited. It's, as I said, it's a bit of a personal spin at the end there, which, it's close to my heart. So I'm very excited to open up about it.
And I think it's really relatable, and it's great for people to hear that, obviously, on the surface, people see Instagram and they see you here, there and everywhere and all these things, but that, so many people have so many things going on behind the scenes that they have to give so much time to every week. You're telling me 28 hours a week just in therapy sessions with your child, plus you're telling me some weeks you work 7 days a week.
That's right. Yes. So
let's unpack this.
We're humans, but sometimes we're a bit of a superhumans, the moment you become a mum.
And you just kind of find time for it, don't you?
That's right.
So let's kick off into some of the topics. So first one, tell us about how you became a cosmetic injector and what it was like going back that 15 to 20 years ago.
Yeah, we're probably even thinking more than 20 years ago because it was before I even became a nurse. So,
yes.
Yeah, so my background was in forensic science. So that was my first degree with anatomy major. And at that point, I was working for a coroner, so worked for forensics. And it was amazing. It was exciting. But it wasn't kind of for me. I felt like something was missing. It wasn't very good for a woman also who wants to have, obviously, kids later on. So the environment was quite dark when I worked. But it was amazing to learn a lot in terms of anatomy and
I'm thinking facial
anatomy was down pat. So at that time, cosmetic industry was very quiet. There weren't many aesthetic clinics around, not many nurse injectors, handful perhaps, and I was always into aesthetics. I always like to do little bits and pieces for myself. So at the time I was seeing a person and I've asked her casually, like, what do I have to do what you do? Because I would love to. I think I'm very good. My passion is also drawing. I love drawing faces. I enjoy art, so being creative and then having scientific background, especially in anatomy. That was my passion when you sort of merge it all together. And the person said to me, look, it's kind of impossible to do what I do. Like you can't get into the industry. It's too hard. It will be very hard for you to do it. Like, don't even try.
Do you think that was the case, or was that a bit of gatekeeping?
I don't know what it was, but I felt like woman to woman. I thought maybe, it would be like, oh, maybe you can help me. But I felt like motivated even more. I'm like, okay, let me think. So I definitely have to finish nursing. So I went back to uni, applied for nursing degree, and I fell in love with nursing, especially emergency medicine, because what I did see then, it was preserving life, where my previous, obviously, career was what I see the end result, where the life is gone. So it was very exciting. And then I have to think, no, I have to stick to my objectives. Like at the end of the day, I need to do what I wanted to do. Stay a little bit around the emergency medicine work, the hospital system, which I said I kind of struggled to leave, but I knew what I wanted to do. My goal is to be a cosmetic nurse. Yeah. With that, I thought, what I've got to do, I have to literally pick up my resume and start looking around. There weren't many nurse injectors. Back then, it was mostly doctors or surgeons who were doing cosmetic procedures or non-surgical procedures like that.
And I imagine if any nurses were working in those practices, they weren't doing the cosmetic injectables.
They weren't. They were normally helping with facial plastics procedures or working as a theatre nurse.
And like post-care.
Or post-care, exactly. Or if they did, it was all well supervised. The doctor had to be on the premises.
Yeah.
So none of that telehealth at that time. We're talking about 25 years ago or longer. So I took my resume, I went around and approached a couple of plastic surgeons and I said, listen, I'll work for you for free. Take me in. This is what I've got.
I'll do anything.
I'll do anything. He just looked at me and it was like that window of opportunity when he said, come on board. And that was like the door opened.
Oh my gosh.
And I thought, I'm going to jump on it.
This is it.
And I put all my effort, all my energy, everything I knew into this. It was amazing because I got opportunity to learn from one of the best facial plastics and ENTs. I've learned so much in that time. So he literally became my mentor.
Yeah.
At that time, our toolbox in terms of what we can work with was very limited. We didn't have those options what we have right now in terms of non-surgical enhancements. It was very simple, very basic, and we had what we had, and we had to work with that. So at that time, I have obviously learned a lot from the plastic surgeon, from a doctor. I accumulated all that knowledge. I tried to put it all in practice, but we needed to have a doctor on premises at all the time. So the telehealth didn't exist. So he was also limited with his time, what he could give me.
Yes.
But also what was happening, he was retiring. So he said to me, listen, this is what's happening. I'm coming off this, obviously, career of mine, and it's time, you have to make a decision what you want to do. So that was back in 2006, 2007. I thought to myself, what do I do? Do I do I just try to open a non-surgical enhancement type of clinic, like a wellness center? It's going to be a big decision. There's not many of them around. And what I needed a doctor's on board.
You needed that support.
I needed a doctor on board. So
because
then
telehealth is relatively new.
Yeah. So that's coming when the industry is growing, developing, and when we have the chain clinics coming on, that's when the telehealth hit.
Yeah.
So that's probably like another sort of 5-6 years down the track.
Yeah.
So I quickly have to think, who do I know? Who do I know back at uni who was a doctor doing medicine with me at the time? I was doing medical science, and I thought of my beautiful Dr. Han at that time. He was doing urology, studying urology in one of the hospitals, and he was working. And I said, Paul, why don't you come on board? Why don't you try aesthetics? And he did.
Wow.
And now he's doing really well. He's almost like a celebrity doctor.
The rest is history.
The rest is history. We kind of merged together, and I opened up Lily Room at the time.
Yes.
2006. Lily Room. Lily means return to eternal beauty from Latin. So that's hence the name. So it was Lily Room Cosmetic Medical Clinic. But I wanted to be like a one-stop shop. So I don't want just to be cosmetic enhancement. I wanted obviously to be place where I have the devices. I have obviously skin, and also colonic hydrotherapy. So it was like all around. So I'm actually qualified colonic hydrotherapist as well. So that's something on board. That was fun fact, yes. So having that all together, we take a pound, we've opened up the clinic, and it was doing really well. The only trouble is the cosmetic industry is still quite quiet. So women were not talking about it. Mm-mm. So there was no word of mouth. We didn't have the Insta. We didn't have the Facebook. We didn't have any of the social media at that time. So we thought, okay, what can we do? Put your backpacks on, letterbox drop-offs.
Oh, wow.
And off we go, walking around, all around North Shore, letterbox drops, making sure that we make our presence in that time. And it worked.
Oh, my gosh.
People starting emerging, making bookings.
Wow.
And next step to another was starting to get busy. And rest is history. So that's my
amazing.
Yes.
And I think because a lot of people would, maybe not stop to think these days that, take away social media and referrals, how challenging it would be to build up a client base. People say it's hard enough now, let alone back before you had any of that. I remember one of the first clinics I started working at, the owner, she was advertising on TV at the time.
Yes.
And her ads would pop up in the evening, and that's how she got out there. But saying there wasn't the word of mouth because the women that were doing the cosmetic treatments,
no one was
they weren't talking about it. And they were sort of, they had the big hat on and the sunglasses coming in. And
I remember still working with the plastic surgeon, and we literally have a separate door for patients to leave after the procedure.
Yes, this clinic had a back door.
Yeah, it was a back door entrance.
We'd taken their makeup off, and they could slip out into the car park.
So no one knew. That was non-existent. Yes.
And how different it is now.
How different
people
it is now.
want to, tell everyone.
Absolutely.
You get so
we
many.
talk about it.
Yeah, you get the friend and say, oh yeah, my friend refers me, and they know what product they're having and what dosing and what areas.
Kind of scary a little bit.
Yeah, discuss it all, right? Completely
That's
different.
true.
So that's incredible that you were able to do that back then. And how long did you have that clinic for?
So I've had Leading Room for almost 16 years.
Wow.
Yeah, so that sort of remained, and I got bought out by another chain clinics at the time, and so hence now I've got the face by Aska.
Amazing.
Yes, so that's continuum, but 16 years it was a good time.
That's amazing. And what sort of team did you build up? How many people did you have working for you?
Sure. I had dermal therapists. I have cosmetic nurse injectors on board. I had a practice manager. You needed one, definitely. And at that time also what I've done, because what I realized, being cosmetic nurse is great, but how can some of my friends were asking, my nurse friends, how can I do what you do? I'm like, brilliant. I have to think of something. How can I help them to do what I do? At that time, I also got handpicked by Galderma to become the clinical trainer.
And that's how I met you.
Yes, that's how we met at the time in training session. But what I realized that it was amazing. The whole academy is absolutely fabulous, but I still felt like it wasn't enough for the newbies, for people who are just getting into the industry and wanting to cosmetic injectables. Yeah. It wasn't enough training.
It's sort of one day here or half a day here
half a day there. You needed more. You really needed some solid course, something that will guide you through it a little bit better. And then I thought, why don't I start an academy? So that was back in 2011.
Wow, I didn't realize it was that long ago that you started the academy.
Yes, 2011, 12, around that time. I thought, okay, why don't I just think of a course which is jam-packed with purely hands-on training. Yeah. There were a couple courses around, but they were not just for the cosmetic nurses, more sort of a mesh between beauty therapy course versus injectables as well. So it wasn't just it. I needed something that it was 3 days, non-stop injecting. They do their theory online, do their exams, and then we sit down and we're learning. I believe in repetitive learning. That's how you learn, with your hands on, doing something over and over again, understanding your anatomy. And that was it. That's when ACMAS, Academy of Cosmetic Medicine Science, was born.
Incredible.
Yeah. And it got busy really quickly because the interest grew.
And just because there was nothing like it at the time as well.
There was nothing like it at the time. And for women who wanted, like being obviously registered nurses, they needed a change in their career or they need something extra on the side. It was perfect. So it got busy pretty quickly.
So on your training academy, for a new nurse stepping into the cosmetic field after, as we've mentioned, basic injecting courses, how can we guide them and help them with medical pathways?
So that was another thing. Once you complete the course, they kind of felt lost. They didn't know what to do after. So I think it's very important that we provided for those nurses medical pathways, which means the opportunity to do master classes, opportunity to do intermediate courses, or maybe even bridging courses if they finished the course and they didn't apply for jobs straight away and they needed more extra revision. Yeah. Even mentoring. I think that's very important. Finding your mentor is the most important thing in this industry. when you're getting in and trying to be a cosmetic nurse. So that's also is on offer. It's in our academy.
Fantastic.
Also for nurse practitioners, if they do want to have that practical hours during the training sessions, they can come on board and assist, and that counts towards the NP.
Oh, that's great.
Yeah. So
that's fantastic. And do you have multiple trainers working for your academy?
Yes.
Yes.
So I have multiple trainers who come on board, and obviously with that you have exposure to different type of training. Through the day we switch and change, so students are exposed to different way of teaching. So
that's great, because everyone does things slightly
different. Yeah, you learn
and
different.
I feel like, you know, even all these years later, you know, when I go to a training session, when you go to a training session, you can always learn something from someone else.
Absolutely.
Right? Yeah, just like a little tweak here or a tweak there.
We'll never stop learning.
Yeah,
and I think that's what it's all about, this school. Also opportunity to, if any of the students wants to reach out and talk to the facilitators, that's also all available to them, just to help them be guided through the next step.
Yeah, that's fantastic. So to recap, with your academy, your students do a online theory component prior to their 3 days of practical.
Yes.
And I've heard from multiple people it is a lot of injecting. You have a lot of models, so they really get to get hands-on, because I do mentoring for neuro injectors, and what I hear, you know, they've gone off and done a 1 day or a half a day course, and they've done, you know, they've done half a lip and half a cheek, and then it's like, oh, well, off you go, and technically off you go, and you can start your own business if you want, but that doesn't give them the tools to feel really, you know,
definitely not. I think
confident.
It's actually a little bit scary to do that.
A little bit scary.
Look, we have up to like 60 models over the course of 3 days.
Incredible.
So it's a lot. So the way it works, it's in vivo assessment as well. Yeah. So obviously when someone else is injecting, someone else is watching. So you watch learning through obviously observation as well. Yeah. But the hands-on is so important. If you do, for example, a lip treatment, you can't learn that by just doing half a lip. You need to do at least 6 of them.
Exactly.
So it's very crucial to keep the classes to a minimum. So no more than 2 to 3 students per trainer.
Yeah.
And obviously hands-on as more model as possible.
Yeah, that's fantastic. And then do you do some follow-up with the students if they did need some more support after that?
At the end of the course, unfortunately, if someone is not up to the scratch, we will not be able to certify them. And we have to have that card conversations as well.
Question.
Yeah, we do.
And that's good that you're not sending people off into the industry that really aren't ready.
We do give them the recommendation, look, you perhaps might need to do a bridging course or maybe a masterclass where you want to perfect your skills a little bit more.
Yeah, I think that's great. And so you also offer courses for more experienced injectors as well?
We do too.
Classes?
Yes, so master classes are very specific. So certain areas which are a bit more difficult and you wouldn't attempt them unless you've been injecting for about 2-3 years. Yeah. So that's also is available.
That's fantastic. That's great. Okay, so let's change the pace for a little bit, Aska, and let's talk about your personal journey. So being a busy businesswoman, a clinical trainer, an educator, and more recently, your experience of having a child with severe autism and how this has shaped you as a human and helped you relate to other women who also face challenges with a child with a disability.
Yes. Oh, that is a personal one, isn't it?
It is. We're going deep here.
I'm going a bit deep there. So just imagine I'm right on the top of the hill. I've got my own clinic. I've got my own academy. I'm a clinical trainer for Teoxane at that time. Everything's going fantastic. I've got beautiful 2 children. I'm falling pregnant with my 3rd baby. How exciting. Everyone's so happy. Baby's born. And then you get the A word. And then you think, I know autism. I know very well of autism. You think of the worst, you know, like you know, there's a different type of autism and you're hoping that it's not. And then you go for another checkup and guess what? We're getting the worst. We're getting the level 3 nonverbal autism spectrum disorder.
And how old was your child at this point?
I knew something wasn't right from the start. Yeah. I'm trying to cuddle my baby and I couldn't cuddle her. I'm like, why can't I connect? Why can't I just hold her? She's stiff. Something's not right. I took her to children's doctor and they told me, no, it's all fine. Don't worry. Bring her back when she's 2. But I knew something wasn't right. I could compare her to my other kids and she wasn't responding to her name. She was different.
Yeah.
So I didn't wait for that 2 years.
Especially having had 2 children.
Yeah,
home,
and something
this isn't the normal development.
It's not. So I took her to every possible assessment I could. I have everything ready. So when I turned up to that pediatrician appointment, which was like 8 months wait, I had all the documentation ready. So when the time came, I'm like, here we go.
Here's the evidence.
Here's the evidence. And within 15 minutes, we had diagnosis of nonverbal. Luna was 2 at that time.
Yeah.
And then she had every single symptom of ASD you can think of. Yeah. It was the textbook for me. Yes. So from there, I been told that she'll never say mama, that she'll never hug me, she'll never have an eye contact with me. I won't be able to communicate with her. She'll be just locked up in her own little planet, and what we can do is just an early intervention. So obviously me running my own business, being busy, I threw myself into the research, trying to, I even started a Master of Autism, trying to learn all about it. So I'm doing that online through correspondence.
Of course you are.
Newcastle Uni. And I have even signed her up for studies at university to research, obviously, a bit more of autism and oxytocin effects on autism spectrum.
Yes. And we started talking about that before we hit record, and that's just fascinating.
It is. What is out there? I had no idea. There's so much. And even I started talking to my patients. Yeah. So obviously when I do treat my clients, it's very personal. Like women feel quite safe on this bed. So they open up to me about their personal issues. And I didn't realize how many women are actually going through the same thing what I am. Yeah. A lot of patients of mine have kids on a spectrum. And I didn't even know all this time up until now. It was very hard because my partner didn't really want to talk about it at that time. No one wanted to put it out there that I'm going through it. So I had to hold it all in and throw myself in the deep end of therapies and trying to work it out what works for her. And, 28 hours a week of therapy, it's a lot for young little humans. I literally have my partner is like a full-time nanny, just taking her to all the therapies, making sure that she does it all. Yeah. And guess what? Just like everyone else, she started to open up a language. So she defies all the odds. Just this year, she spoke for the first time, and it's incredible. It's actually quite bizarre language because it sounds really mature.
Yes.
But she's communicating.
And the sentence you said again before we hit record, that she came out with just recently to one of your other children.
Yes, she said to my 6-year-old boy, Zeus, don't be naughty, otherwise no iPad.
That's a full sentence.
It's a full sentence. And she stopped being naughty. She's like, Mom, Luna just spoke. Guess what? So it wasn't the first word, mama. I think her first word was xylophone, which was quite bizarre.
Okay. Yes. That's pretty, that's a big word.
It's a big word. Luna's also his savant. So she can read fluently. So a lot of these kids with autism have a condition called hypolexia, where they can read.
Yes.
But she can read and understand as well. So she, at the age of 2, she was reading books. I could literally give her a consent form and she'd be reading out loud. So that's if I wanted to hear voice, I'd just give a text to read. Yes. And that's it. But if you ask a question, what's your name? Or what are you doing, baby? It's non-existent in her own little planet. Yeah. But that's getting better.
That's amazing. Yeah, and then, like you said earlier, she'll come out with random things like the Russian alphabet.
Or the Russian alphabet out of nowhere. So that's where the savant genius comes. She'll be sitting there, started singing Russian all of a sudden. As I said, I'm not Russian, I'm Polish, but Google the Russian alphabet and it's word by word. It's incredible. Her mind is incredible. So through the early intervention, through me trying to direct her the right way, I think we'll be fine. Yeah, so she defies all the odds.
Absolutely.
All the diagnoses that she'll never speak, that she'll never hug me, she'll never call me mom, they were all wrong.
Yeah. Wow. What such almost a very sort of solid final diagnosis when they say this is how it's going to be and nothing's going to change. But, kids develop for one, and you didn't give up, and you're like, no, I'm not going to accept this. This isn't going to be the case. And all the research you did on that early intervention and this clinical trial that you've been involved in as well.
Yeah, that's incredible. So we're still waiting for the results, but
seems as though there has been an improvement since then.
Yeah, definitely.
That's incredible. And is your partner looking after Luna full time, or does she go to daycare?
So Luna goes to Autism Research Centre.
Yeah.
So that's where she gets her therapy like 8 hours a day.
Wow.
3 times a week. Obviously my husband, he's very hands-on. With her, he's incredible. He makes sure he takes her to all the therapies, and I as well, as much as I can between my work and commitments. But yeah, together I think we do it pretty well. We're a pretty good team.
I think you're a pretty good team. And did you, obviously, he's an amazing support. Did you have to make some adjustments to your work life to, for these other demands of, needing to be in therapy and obviously be there for her a lot more than maybe what you're expecting when you're bringing your third child into the world?
That's right. So that's amongst all my other kids and extracurricular activities after school. Autism spectrum diagnosis, like some women can't even continue with their career. They literally they advocate for their kid, and that's it.
Yeah.
Like, there's no time. So having my husband being so hands-on was absolutely amazing, because he allowed me to do what I do and continue with my working career, and obviously stepping in whenever I can to be part of her journey with the therapies as well. Yeah,
you gotta work as a team. And onwards and upwards for you guys. And I really appreciate you sharing this. And as you said, so many of your patients are going through similar things. And I know that people listening to this and watching this will be able to really relate to you, and just know that there's generally always more going on behind the scenes.
Absolutely.
Than what we see
we're
on
all
Instagram.
Humans. Yeah. We're all humans. We all have our story there. And I think, I never thought this will happen to me. Yeah. Not in a million years.
No, not at all.
And there you go. Here I am.
You're doing amazing. So switching back to cosmetics, I've got a couple more questions for you. We have covered this a little bit, but maybe sort of in summary, advice to new injectors getting started in the cosmetic industry.
What advice I would have given you, it's definitely finding yourself a mentor. So if you're getting just into the cosmetic industry, you completed a course and you're not sure where to go, you can always reach out, whether to myself or Jamal or any of our facilitators at school, or even maybe your colleagues who've been in industry for a while. I think that really helps getting your foot through the door, and definitely attend all the conferences. Try to reach out to as many companies as possible to get on board, because I think it's really important. Education and getting yourself out there as much as you can is so crucial to get into this industry.
Yeah, just immersing yourself in it.
And once again, looking back and then, there's so much available now. We almost have a conference every week.
Yeah.
I'm talking about 20 years ago, we only just wait for that 6 months, that non-surgical symposium that was there. And now, like every week, there's some sort of event and
you
information.
could literally go to something every week.
There are webinars online that you can attend. So there is a lot of education available for nurses. You just need to search out, reach out, and do it.
And if you have a question, there's someone out there with the answer, or someone who's done it and maybe learnt the hard way.
Yeah, absolutely.
So I definitely say, even though it's hard, that aspect of things have been done now. So it's not like people are sort of trying to reinvent the wheel. It's just you've got to immerse yourself in it. And like even to this day, I still use mentors. Especially like when we move through different phases. Like a year ago, I've gone from a 1-room, 1-woman show to now a 5 treatment room clinic with a team.
Yes.
And I'm like, I need some help with this, because, up until now, it's very much had my, cosmetic nurse hat on. And while that's still on, it's like, oh, now I need to actually really level up as a businesswoman, and having a team around me and how I can best support them, and make sure we, head in the right direction. So, I've now sought out more mentoring to help me with this much bigger space. So
we'll never stop learning.
Always learning. Yeah, totally. Advice to existing nurses, clinic owners navigating the new TGA regulations.
Oh, yes.
This is a hot topic at the moment.
That is a hot topic at the moment, and it is a tough one. And I think, look, you probably see it that on Instagram, everyone is trying to figure out what do we have to do, what do we have to say, what's wrong, what's right. I say, just take it easy, take a deep breath. Let's just all wait for obviously advice and what will happen. Do the right thing, listen to the instructions, and pretty much do what we're allowed to do. Okay.
Exactly.
If we can't do before and afters, stick to that.
Yeah.
If we can just talk about skin and that's all it is, let's just do that. Maybe soon enough we'll have some more sort of strict guidelines and to give it some sort of directions. But at the moment, obviously we had the instructions, so let's just follow the rules and I think everyone will be fine.
Yeah, that's good. Just, don't stress, because you see a lot of people just getting,
people
really
are panicking and
worked up. And
just follow the rules. It will be okay.
Yeah.
I think it will be okay.
Yeah, I think, these things happen every few years. There's some changes and we always adapt and find, new ways to continue to educate people online.
Exactly.
Yeah.
Exactly right. There's different ways we can educate and, show our life as a cosmetic nurse.
Yeah.
Obviously, we're still on social media. That has not been banned.
We still do the same treatments.
We're still here. Obviously, make sure we communicate to the patient to reach out, and maybe there's a bit more that face-to-face contact now and over-the-phone contact.
And maybe people will, especially consumers and patients, will put a bit more emphasis on that consultation process,
which I think is very important.
Yeah,
very important.
Yeah, I think it's everyone will be fine. And advice to clinic owners and registered nurses wanting to expand their services beyond the cosmetic injectables. And I think that sort of really plays into what's happening with the TGA at the moment. A lot of people are sort of going, oh, quick, well, we can advertise skin on social media,
That's
so
right.
we better do skin.
Yes.
And I think we'll definitely see a big change of people switching, or not switching, but expanding.
So that's what I think is happening right now. You see the trends are changing. So obviously everyone's jumping onto the skin and devices and things we can obviously show on social media, and it is happening, and that's fine.
Yeah.
It is what it
is.
is.
It's potentially a way for people to actually start to expand their business and expand
exactly
their services.
Right.
And you're only going to have happier patients. Their skin's going to look better.
Yes.
Their cosmetic treatments are going to look better. So it's a win-win for everyone.
But for me, it was always that synergy between obviously skin and devices and enhancements. Exactly. I think that's all go hands in hand. So if you do expanding a business in that direction, brilliant. Congratulations. I think, maybe it's a bit of a push from TGA for everyone else.
Yeah, and even this week I've got, in my notes to talk to my team about is that we need more skin before and afters.
That's right. Yes.
Skin, and we want skin videos, and we're looking at some new devices and new treatments. So I think it's definitely an opportunity to really push those things forward.
That's right.
Yeah.
I agree. Thank you so much for having me here today and, touching on all that, and especially on my personal aspect of my life and as an injector, as a mother and a trainer. And I'm looking forward to seeing you there.
Yeah.
Out in the field.
Totally. Training sessions and conferences. Yes. And now we have a big proportion of our viewers and listeners are registered nurses, and I know that their ears would be pricking up listening to you talk about your academy. So how can they best find you?
So you can find me online. So obviously www.acmas.com.au. So that's our website for the academy. And obviously through Instagram pages, I'm always there. All the information is there. It's all available for everyone.
Yeah, fantastic. Thank you.
Thank you.
Thank you so much for tuning in to episode 20 of this video podcast series. You can find us on YouTube, Spotify, and Apple. And a huge thank you to Aska for joining me today. That was a great chat.
Thank you so much for having me here today, Felicity.
Absolute pleasure.
I really appreciate it. Thank you.
Bye.